see each other almost every day, but thank you, sir. Our chances of mobility, because with so many fractures or anything, mobility becomes an issue. And when a person is dependent on others for mobility, that's when doctors like Pawan Chebi come in and operate something special. And the patient is not dependent on anybody to walk or move around. I think today the focus is that how mobility is so important for us. So without taking much time, I will hand over the entire thing to Dr. Chebi, and he will call on the patient, and then we can take it forward from there. Sir. Thank you, sir. Sir.
So here's Mr. Sanjay Singh. I would like to introduce Mr. Sanjay Singh.
So you can see how well he can walk. I mean, a patient who had things, but it's a beautiful thing that sir is able to
have a special interest in joint replacement, sports injuries, sports-related injuries, and most importantly, deformity correction. So here, what happens is when we talk about orthopedics, just like Mr. Vinayak was saying just now, it's not just for pain relief, it is for mobility. So a lot of times we see people with injuries go slowly into a state of disability. So kind of they get into a state of disability or reduced mobility. They stop playing, they stop running, they stop being independent. Especially this happens in the older age. And nowadays, it happens much more earlier. 50s, 55 years olds, they become dependent on their children, or they're sent away because of some deformity they have, because they are not dependent. So here, this is one of those typical cases when in 2019, a gentleman had an injury to his hip joint, for which he was operated upon somewhere in North India. There he had put a intramedullary device, that is, a fixation of the fracture was done by an intramedullary device. Now, unfortunately for him, on the second or third day of surgery, it was told that the implant is not proper and they have to do some realignment. So once the realignment was done, he was okay for a few weeks only. Then again, on the subsequent follow-up, the doctor told that he had to undergo an exchange of the implant because it is not proper. So you can share about it.
हेलो, मेरा नाम संजय कुमार सिंह है। मैं गोरखपुर यूपी से बिलोंग करता हूँ। 2019 15 अगस्त को मेरा एक वो बाथरूम से निकलते समय पैर स्लिप कर गया था, तो मेरा फ्रैक्चर राइट थाई के पास हुआ था। तो उस दिन 15 अगस्त का उस दिन तो मुझे डॉक्टर भी कोई नहीं मिल रहा था, लेकिन चूँकि मैं बैंक में काम करता था वहाँ, तो फिर मेरा थोड़ा सा ये करके प्रभाव करके डॉक्टर से दिखाया। तो इनिशियली तो उन्होंने बोला कि फ्रैक्चर नहीं है, गुल्ले के पास फ्रैक्चर था, लेकिन सीटी स्कैन हुआ तो उसमें मेरा फ्रैक्चर निकला। तो उस दिन तो हॉस्पिटल कोई खुला नहीं था, तो उस दिन कुछ हुआ नहीं। इंजेक्शन दे के उन्होंने पेन को थोड़ा सा सबसाइड किया। दूसरे दिन गया तो वो स्कैन का भी सीटी स्कैन का भी रिपोर्ट आ गया था, तो फ्रैक्चर उसमें निकला था। तो उन्होंने फिर मेरा ऑपरेशन किया और वहाँ पे रॉड लगा, लेकिन रॉड लगने के 1 महीने बाद मुझे फिर अचानक बहुत सीवियर पेन होना शुरू हो गया। फिर मैं डॉक्टर के पास गया, पेन बहुत ज़्यादा था, तो उन्होंने बोला कि यहाँ पे बोन थोड़ा सा आपका वीक है, तो लोकेशन शिफ्ट करना पड़ेगा। तो उन्होंने लोकेशन शिफ्ट किया, लेकिन फिर ये प्रॉब्लम मुझे 1 महीने बाद फिर होने लगा। उसके बाद फिर उन्होंने उसको ऑपरेट करके फिर सही किया और बोला कि आपको 15 दिन तक बिल्कुल हिलना नहीं है, सिर्फ बाथरूम आप जा सकते हैं, वो भी वॉकर के साथ। खैर वो ऑपरेशन हुआ। इसके बाद नवंबर में मैं थोड़ा सा स्टिक के सहारे चलना शुरू किया, उससे पहले वॉकर पे ही चलता था। तो मैं गंगाराम में गया, वहाँ भल्ला साहब ने देखा, उन्होंने वो मेजर किया तो 1/2 इंच का दोनों पैर में मेरा गैप आ गया था। तो उन्होंने बोला कि 1/2 इंच का गैप है तो आप जो है इनसोल आउटसोल यूज़ करिए, तो इससे दोनों पैर बराबर हो जाएंगे तो पेन आपका कम हो जाएगा। फिर मैं चलता रहा, इसी तरह चलता रहा। फिर रिसेंटली अभी अक्टूबर में मैं दिल्ली गया था, तो फिर मुझे थोड़ा सा ज़्यादा दिक्कत हो रही थी, इम्प्रिंग मेरा बढ़ गया था, तो उनको दिखाया। फिर मैं भल्ला साहब से अपॉइंटमेंट लेके दिखाया, तो उन्होंने देखा होगा, मेजर किया, बोले कि नहीं आपका ये गैप बढ़ रहा है, ये ठीक नहीं है। उन्होंने एक एक्सरे भी कराया, तो बोला कि देखिए ये अभी चल तो सकता है, 1.5 साल ऐसे ही चलेगा, लेकिन आपको प्रॉब्लम उस दिन ज़्यादा हो जाएगी जिस दिन ये आपका नेल जो है वो बोन में टच करेगा, तो आपको बहुत प्रॉब्लम हो जाएगा। फिर आपको तो फिर मैं आ गया, पवन सर से मिला, तीनों ने भी मेरा चेकअप किया, तो बोले कि नहीं आपको ऑपरेशन ही कराना पड़ेगा, वो आप हिप रिप्लेसमेंट करा लेंगे तो ये सही हो जाएगा। तो बिटवीन मैं फिर चला गया, अपना गांव चला गया, फिर लौट के आया, तो दिसंबर में प्लान ये होगा कि दिसंबर में कराएंगे। फिर यहाँ आके हम लोग इनसे मिले, तो इन्होंने 21 दिसंबर को मेरा ऑपरेशन किया। हालांकि पहले इन्होंने बताया नहीं था, ऑपरेशन बहुत मेजर था, 4.5 घंटे तक मेरा ऑपरेशन हुआ और मैं होश में ही था, लेकिन मैं देख नहीं सकता था, बीच में एक कर्टेन लगा हुआ था और वहाँ लोकल एनेस्थेसिया था, इसलिए मुझे कोई पेन नहीं हो रहा था। अब वो जो था सर ने अपने आप में रखा हुआ था कि पेशेंट घबरा ना जाए, इसलिए आपको ये उतना मेजर चीज़ नहीं बताया था कि नहीं यू विल बी ऑल ओके आफ्टर ऑपरेशन। बाद में इन्होंने बताया कि नहीं आपका बहुत मेजर था। 3 मेजर प्रॉब्लम्स थे हमारा, एक तो लिम्परिंग था, पेन मेरा हो रहा था और ये गैप मेरे दोनों पैर का बढ़ रहा था। तो अभी फिलहाल तो मेरा गैप ख़त्म हो गया है, चलने में भी अभी थोड़ा सा पेन है, क्योंकि इधर मेरा राइट साइड में जो वो इम्प्लांट लगा था उसमें कई स्क्रू भी लगे हुए थे, तो उसको सर ने उसको फिलअप किया है, लेकिन वहाँ बोन एक्यूमुलेट होने में सर का कहना है कि थोड़ा सा अभी और टाइम लगेगा। तो जैसे जैसे आपका बोन स्ट्रॉन्ग होगा, आपका जो भी ये पेन है वो ख़त्म हो जाएगा। सर ने ही सजेस्ट किया था वो इसके लिए फिजियोथेरेपी के लिए, तो राजेश जी की टीम ने मेरा फिजियोथेरेपी किया और बहुत पर्सनल।
Which one, sir? In what?
For multiple complications. How you
Okay.
the cost of the expenses?
Okay. So, whenever I get a patient, I try to minimize the operating time. I try to minimize the number of procedures the patient has to undergo. Okay. So, any orthopedic procedurally, some procedures are there, especially revision procedures. ಕೆಟ್ಟೋಗಿರೋದನ್ನ ಕರೆಕ್ಟ್ ಮಾಡಲಿಕ್ಕೆ one shot ಅಲ್ಲಿ ಆಗಲ್ಲ ಅದು. Bone loss irutte, ligament loss, hip joint. Okay. So arthritis because of injury, because of old age, because of calcium deficiencies, because of any congenital conditions, and most importantly, post-COVID, we are seeing avascular necrosis. You must have heard of that also. So in that case, a destroyed hip, we do a replacement. Now, when we do a hip replacement, we need that area to be pristine and clear. We don't want anything over there. We don't want any chance of infection. We don't want any inflammation of any sort. But if there is a foreign body already inside, that is a rod already inside, that is one. Second is, the rod has already eaten away the bone over there. That is number 2. And we can do 2-staged also. But I was inclined on doing a single-stage surgery. The reason is, if I do a 2-stage surgery, when I remove the implant, there is nothing over there. And the patient has to be bedridden. And what happens, it breaks the confidence of the patient. That is patient, number 1. Plus also patient muscle cell will become weak. Everything. This is how the normal hip joint should be. Yeah. This is the cup on which the ball should sit. And this angle is what matters, so that whether the person limps or not limps, it depends upon this angle. So he had a fracture here, which was fixed with that, and now because of that there was a lot of gap, etc. So this is the implant which we have put. You can see how correctly, snugly it is fitting on the sides. It should not be too thick, because if it is too thick, it will pierce the bone. It should be perfect. It should not have too much of, we prefer to do cementless, which is more stable. And here we have, the cup component, which is sitting exactly and through which the ball is sitting. So everything is how it's supposed to be. And if you see this, the gap over here and the here, in this particular, this line over here is sitting correctly. The hip joint has become perfectly straight. The pelvis has become straight. Before, it was like this, it had completely lurched out, it had completely gone here. So now it is perfectly straight. So this is the X-ray which we have taken of the patient today. Which we thought was, or rather about 5 years ago, we used to send this overseas, we used to send it to another country for the design, where they take all the template, ready ಮಾಡಿಬಿಟ್ಟು ಕಳಿಸ್ತಿದ್ರು. This is available in India, this is available in Bangalore now. So we designed this according to his size. Then this is the cup, this is the head. Now here, this is a ceramic head which we have used. So the round thing which is there, so this is a ceramic head which we have used. The advantage of this is, it is very long lasting. It's very hard and strong, it's very long lasting. It is not very heavy, and also articulation is perfect. So such things you have commercially available also, you have different sizes also, but to design it for a particular patient was a little bit of a challenge. So thankfully everything happened on time. That is one thing. That is one major thing. Other than that, during the surgery, there were a few challenges. That is, retrieval of the implant was a challenge.
He is very well equipped. We've done, good head and neck surgeries, and sir has done so many replacement surgeries, complex surgeries, and you name it, it has been done. So we focus on surgeries because patients don't want to stay for long in hospital. So that's why you call it a short stay surgery. If it is a replacement surgery, of course, 5-6 days you need to stay. But there are surgeries when people come in the morning, get operated, by evening they go. We talk about varicose veins, vascular surgeries. They will go the same day itself. Even some orthopaedic surgeries also, I think knee replacement, shoulder surgeries, they go the same day or the next day morning.
The cost also comes down.
Cost, yes, of course, it will come down. So the other factor is that, I don't want to harp on cost, but yes, we are more cost effective because our billing is, it's a package kind of a billing. So people know we are very transparent. So here we have altogether around 22 beds, including post-op. Most of the rooms are single rooms. We don't have double sharing because we want to give that privacy to patients. So we do it, and as I said, patients don't want to stay in hospital. The sooner they want to go post the treatment, they want to go. So that's what we do at Spectra.
But will this be covered in the insurance?
Yes.
Hi, my name is Dr. Pavan Chabbi. I'm a consultant orthopedic surgeon here at Apollo Spectra Hospital, Kormangala, Bangalore. So this particular press meet is for discussing about a challenging and complicated case of one Mr. Sanjay Singh. He had a fracture of the hip joint way back in 2019, and this was operated somewhere else in North India. After multiple failed surgeries for that, which had started off in 2019, he developed a limp and shortening of his right hip joint. So this particular issue was particularly a challenge for a further surgery because of presence of an implant already in the hip joint, the bone loss because of a implant which is eroding the bone around, and also the increased limb length discrepancies, that is increased shortening of the length of the limb. So with all these challenges in mind, we had to design a custom-made, individualized hip so that we try to finish this surgery in one stage, which is ensuring or helping the patient to get mobile immediately after the first stage or the single stage of surgery. So keeping this in mind, we used this particular implant which was helped by Merrill, So this is just the same copy which he has got inside. So we got this prepared and we did the surgery which took about 4.5 hours. That is to remove the implant, clear the bone and put a fresh implant and do all this without any complications. We finished the surgery successfully on 24th of December. 21st of December last year. And it's been roughly about 2 months today and he's doing perfectly fine. Honestly, I had a lot of doubts when I started off with this, but I was confident that it will be successful because we did our homework well. Our team had done our homework well. And also post-operative physiotherapy, which is an essential part, and Mr. Sanjay Singh did cooperate with us to do all the physiotherapy activities properly without any hiccups. And here we are, standing continuously with us, standing straight, Mr. Sanjay Singh.